I'm based in Hartford, Connecticut.
Tampa, Florida.
New York City.
Park City, Utah.
We're having an offsite today for the Clinical Insights and Analytics team.
We've brought the entire team to Boston to go over projects that we have in the works.
The CIA team has three main purposes. One is to reduce medical expense, the second is to improve medical quality, and the third is to evaluate new medical technologies and their impact.
Over the past few years, we've looked at topics such as the opioid crisis, gene therapy, chronic care management, end of life, and hospital-acquired infections. The CIA team is a group of medical directors, program managers, data analysts, and partners across the enterprise.
We are a clinical think tank. We have both the clinicians, the project management, the operational expertise, and the data analysis all in one place, all working cohesively. And we're all working towards the same goal, which is to drive better value of care for our members.
We really get the benefit of having lots of different viewpoints.
The medical directors are the backbone of the work we do. They're frontline with our providers and members often and can see things that we should be researching.
From a medical perspective, I may have a sense of what does occur, or certainly a sense of what should occur, but I can't tell what is actually occurring. Whereas the analyst can go into the database and be able to get answers to be able to tell me what is actually occurring for our members. We're able to look at whether it's the medical literature or the lay literature or even just somebody's experience in the healthcare system and be able to ask questions of whether this is happening for our members as well, and whether there's an opportunity to improve it.
We look very holistically at not just claims data, not just pharmacy data, but we look at even external sources of data like census data.
The work of the Clinical Insights and Analytics team can be seen in a number of initiatives positively impacting patients.
So I'm happy to help.
In the Guardian Angel program, specially trained case managers work with members who have recently survived an overdose to connect them with resources toward lasting treatment and recovery. The Rush to Brush initiative identifies Aetna members going into surgery and arms them with an oral health kit and education to protect them from hospital-acquired pneumonia. And now, a new Minute Clinic pilot will allow patients with diabetes to work with our nurse practitioners to start and adjust their insulin dosing to make sure they're receiving optimal, high-value care.
We leave no stone unturned.
After that initial evaluation is done, we massage that data and get it to a state where you can tell the story and say, well, this is what's happening with our population.
Our team is very small. We fight above our weight class. We bring probably on average $45 million in savings to the company with a very small team.
With the combination of both CVS Health and Aetna, we can broaden our impact on the healthcare system.
CVS Health allows us access to members when they're in the pharmacy, interacting with their pharmacist, using the Minute Clinic, or even in the health hubs that are being created across the country.
This is a great way to bring synergies of the two organizations to be able to identify the medical problems that people have, the care that they're getting, and then being able to interact with them one-on-one, face-to-face, to make sure that they're getting the care that they need.